This session is how to prevent type 2 diabetes. So thank you all for being here today. As you heard, this session is being recorded. But to introduce myself first, my name is Maria Cecilia Mosquera. I am a public health preventive medicine physician and a pediatrician, and I'm certified in lifestyle medicine and in obesity medicine. I work at the University of Nicosia Medical School in the Department of Primary Care and Population Health. Since I mentioned to you that I'm a lifestyle medicine doctor, I wanted to share that lifestyle medicine works on 6 different pillars, as you see on the screen here. So in lifestyle medicine, we work on healthy eating, physical activity, helping people manage stress, work on optimizing their relationships, their sleep, and on avoiding risky substances. So today's topic about preventing type 2 diabetes aligns well with lifestyle medicine, and we are going to be touching base on a couple of the features of lifestyle medicine, healthy eating and physical activity. But I wanted to acknowledge that the whole of us as human beings is important for our health, and so although we're not covering those topics, we continue to acknowledge the importance of all of our well-being. So this session tonight is being brought to you by the Medical Center of the University of Nicosia Medical School. So thank you to the Medical Center for bringing this activity today. Also, we may have some patients from the Medical Center here today, and if so, welcome. As you heard earlier, this session is being recorded, and part of that is so that we can save the video on the Medical Center's video gallery. So if you feel like you want to look at this video later, or maybe there's a part that you missed or a screen that you wanted to see later, just remember this is being recorded and you'll be able to access it later. Additionally, because we are going to have some patients and community members access this video as a recording, I'm putting this screen up right now that shows people how they can auto-translate this session into Greek, because we are having an English language session today. So first of all, Happy New Year to everyone. And hopefully this is a new year of continued wellness for all of us. I know that as the new year starts, many people start thinking about the ways that they want to move towards wellness or improve their wellness in the new year. Some people make resolutions. And so that is part of why we wanted to hold this session today, is to support all of us that are thinking about how to have a year full of wellness. This particular topic today is specifically about what we can do to help prevent type 2 diabetes. The conversation today is open to anyone, but perhaps we have some patients of the Medical Center of the University of Nicosia, like I said today, and if so, welcome. Or perhaps we have some students or faculty or staff of the University of Nicosia Medical School or of the wider University of Nicosia campus, and we welcome you as well. The conversation today is for all of us who are human beings that want to think about how to prevent type 2 diabetes. So you are all welcome. Just so we are clear on what we're going to talk about today, we're going to first talk about what is type 2 diabetes, and then we're going to cover physical activity, managing your weight, healthy eating, and making smart goals. It is a 1-hour session, and I said I'm a lifestyle medicine physician, so I actually encourage you to stand up, stretch, or move as you participate in this presentation. And you do have the capacity to write in the chat box, so please feel free to use it. I'm going to be asking some questions periodically, or if you have some questions or comments, please add them there. I'm watching the chat box, and I would encourage your interaction. And if at any point you feel like you want to unmute yourself, please just ask us. So I wanted to start with what is diabetes, because we want to make sure we are all sharing and talking about the same definitions. So let's start by thinking about the fact that glucose, which is basically sugar, comes mostly from food. And when we eat, let's say you already had dinner or you just had a snack, then the glucose level goes up in your blood. But I said that glucose is sugar, but that doesn't mean it only comes from table sugar, like the type of sugar you use to sweeten your coffee. Glucose comes from any type of carbohydrate, and carbohydrates are 2 categories you can see on the screen here in the figure on the right-hand side. Starchy carbohydrates, which is the pictures on the left where you can see things like potatoes or chickpeas or rice or bread. And the other category are sugars, those that are natural, like an orange, for example, has natural sugars, or table sugar that you might put in your tea or honey, but it can also be cookies and cakes, juices that are unsweetened, even milk has a form of sugar that's called lactose. So we're talking about the sugars that are in our foods that come from carbohydrates such as starches and the simple sugars. And we all need glucose because it gives our body energy. The thing is that in order for our body to use glucose, our body needs something that's called insulin. And insulin is made by our pancreas, which is an organ in our body. And you can see that on the picture on the right-hand side. So if we want to be able to walk and move and hike and move around Cyprus, we need glucose and we need insulin made by our body to be able to use that glucose. But people who have diabetes don't have appropriate insulin. So that means that they can't use their glucose appropriately or drive it to help us make energy. And so what happens is there are different types of diabetes. In some types, people don't have any more insulin at all. In some types of diabetes, people have enough insulin or they can't use their insulin well. And so what happens if you don't have insulin, you can't help, your body can't use the sugar in your blood. And that means in your blood, the sugar level starts going up and up and up and up, and it can get too high. So that's why when you go to the doctor and they test your blood to see if your sugar level is high, they're checking to see what's happening in your body that can help us think about whether you have diabetes or are at risk for diabetes. I just wanted to share here that, as I said before, there are different types of diabetes. Today, we're specifically going to be talking about type 2 diabetes, but I wanted to acknowledge that there is also type 1 diabetes. The people that have type 1 diabetes, we usually think about young people, for example, that can no longer make insulin. So these are the people that have to give themselves injections of insulin because their body doesn't make insulin anymore. And that happens pretty much as soon as they get type 1 diabetes, almost from the beginning. Whereas those of us who have family members with type 2 diabetes, or maybe we're at risk for type 2 diabetes, what happens for people who develop type 2 diabetes, when their sugar starts building up in their blood, their pancreas isn't making enough insulin, or the insulin doesn't work well anymore. That's what happens. So people that have type 2 diabetes don't have to take insulin usually from the beginning, but later on, if you continue to have type 2 diabetes or it gets worse, your pancreas can get tired and can stop making insulin. So sometimes people who have type 2 diabetes also later on in their life may need to give themselves injections of insulin. So just to acknowledge, we are talking about type 2 diabetes today, which is the most common type of diabetes. As you can see in this little graph here, in the part in blue, shows us from the UK, the United Kingdom, that about 90% of people have type 2 diabetes. So 9 out of 10 people who have diabetes have type 2 diabetes, which is why our focus today is going to be on type 2 diabetes. So our goal and our hope is to have normal glucose. Sometimes your doctor may tell you they've checked your blood and your blood level for glucose is a little bit high or borderline high. Maybe they told you you have pre-diabetes or that you're at risk for diabetes. And then there are people who, when the doctors check their blood, already have high glucose level, they already have diabetes. So the topic we're going to be talking about today actually is going to help all three groups of people, people who don't have diabetes or at risk for diabetes, or already have diabetes. So even if you happen to already have diabetes, what we're talking about today can also help you. And why do we want to prevent ourselves from getting type 2 diabetes? Well, the problem with diabetes is when the sugar is high in your blood, your glucose is high in your blood, all kinds of things can happen, such as you can be more at risk for heart attacks, strokes, problems with your eyes, even leading to blindness, for example. You can have damage to your nerves and your kidneys, even to your feet. Some people who have diabetes and lose their circulation in their feet may even later on, if they have complicated diabetes, need things like amputations of their feet. It can lead to gum disease and sexual problems. So with so many things that type 2 diabetes can cause, it's our hope that with today's conversation, we can talk more about how can we prevent ourselves from getting type 2 diabetes. I mentioned before that some people are at risk for diabetes, perhaps by your blood level because your sugar is already a little bit high, or maybe you're a family member. Maybe your father had type 2 diabetes. As we get older, our risk for developing type 2 diabetes gets higher. If you had, for example, diabetes when you were pregnant, you're more at risk for developing type 2 diabetes. Or if you have had heart disease or stroke, or you have something called polycystic ovarian syndrome. The people who I've mentioned before that when we check their blood already have a little bit elevated glucose who might have pre-diabetes are at risk for getting type 2 diabetes later. Also, if you're overweight or obese, or you're not physically active, you're also at risk for type 2 diabetes. And why am I mentioning who's at risk? That's because some things I can't change. Like I can't change the year you were born, right? But things that we can change are if we're overweight, obese, if we're not being physically active, for example. So those are the things we're going to talk about today. There are some things we can make better. So what helps us prevent type 2 diabetes? And it really is about our lifestyles. So there are three big topics we're going to cover today. One is our weight, two is how physically active we are, and three is healthy eating. And all three of those have been shown in many research studies to make a big difference in helping people prevent themselves from developing type 2 diabetes. So we are going to start with talking about our weight. So what do we know about weight loss to help prevent diabetes? So in the United States, there's a large study called the Diabetes Prevention Program, where adults who were already at high risk because let's say they were obese, if they lost 5 to 7% of their body weight, that cut down their risk of getting type 2 diabetes by half. And that's pretty significant, just losing 5 to 7% of their body weight. But you may say, what exactly does that mean, losing 5 to 7% of your body weight? So let's say if you weigh 200 pounds, that would be losing about 10 to 14 pounds. And that's not by tomorrow, that's by, let's say, over the course of the next 6 months to a year. Or if you prefer talking about kilos, if you weigh 100 kilos, that would only be losing about 5 to 7 kilos might help you cut down your risk of diabetes even up to by half. So losing weight, even just a little bit, 5% of your body weight, can lower your risk of developing diabetes by quite a lot. So some people might think I need to lose so much weight in order to make sure I don't develop diabetes. Well, these large studies have showed us just by starting with 5% of your body weight can help. And so that's for people who are already overweight or obese. If you are at a healthy weight, you want to stay at a healthy weight because that can help you prevent from getting type 2 diabetes. Because if you become overweight or obese, then your risk increases. And if you are overweight or obese now, we want to move you towards a healthy weight because not only can it help you prevent type 2 diabetes, but also you would feel better. It can make your blood pressure better and your cholesterol better. It can lower your risk of heart disease and some cancers and a lot more. So how do we lose weight? Well, first you have to know what your weight is. So if you haven't weighed yourself recently, you might want to touch base with your doctor or your dietitian or your other healthcare professional to make sure you know what your weight is. And usually we will calculate something called a BMI to tell you whether you are at a normal weight, whether you're overweight, or whether you're obese. So it's important you know where you are today. And then work with your healthcare professional, for example, to start with just losing 5% of your extra weight. And the goal is to lose that slowly. So it doesn't mean by next week, I want you to have lost, let's say 10 pounds if you're 200 pounds right now. What it means is over the course of the next 6 months or a year, you can make your initial target that you're going to lose 5% of your body weight. And your healthcare professional can help you calculate that. And how do you lose weight in a healthy way? Well, you have to continue eating, but you eat a balanced diet and fewer calories than you need right now if you're overweight or obese, for example. And getting regular physical activity helps. Getting support from your family or your social circle or your healthcare professional can help. And tracking your progress can also help. So we talked about weight and the importance of a weight loss and how actually that's one of the things that can make the biggest impact to help people prevent type 2 diabetes, particularly people who are already overweight or obese. So think about where is your weight today? Are you overweight or obese? And if you are, can you just make a small target of losing a little bit of weight? And even losing that little bit of weight can make a big difference on whether you develop type 2 diabetes. So now let's talk about physical activity. That's the number 2 important topic when we talk about some lifestyle changes that can help us prevent type 2 diabetes. So we have some people who have joined us today. If you're willing to share, I'm watching the chat box right now, and you can open your chat box and you can just put in your answer to the panelists if you don't want anybody else to see. But would anybody be willing to share? Perhaps there are some ways in which you're already actually including some physical activity in your life. And I would welcome you all to share with us. And what I can do is I can read them, and I don't have to share your name if you want to just share with us. Does anybody here already try to include physical activity in some way in your life? And while we're waiting to see if people would like to share, I'll share with you that I try to walk my daughter to school in the mornings. I could drive, but I live close enough that I can walk. And so I try to do that as many mornings and in the afternoons to pick her up as possible. I know that's not available to everyone, but that's one way that I try to include physical activity in my life. And I also try to include some resistance training and schedule that into my week. So I see that somebody has graciously shared what they're doing, and somebody says that they try to walk as much as they can, and they're going to the gym 3 times a week. So that is amazing. Thank you for sharing that you're already walking as much as you can and going to the gym. So I appreciate you sharing that. So right there was mentioned walking, which is purposeful exercise and physical activity, and also the gym. Sometimes when we go to the gym, we either do aerobic exercise or resistance training, weight training. All of that sounds wonderful. So thank you for sharing that. It's important for us to think about physical activity. It's actually one of the tools that we don't use as much as we could, because if you look at the screen here, physical activity has so many benefits. It not only helps your physical health, your body, but it can help your mental well-being. So if you look at this image on the screen, you can see on the left that there are some immediate benefits to doing physical activity. 1, it can make your sleep better. 2, it can make you feel less anxious. 3, it can improve your blood pressure. And that's just immediately after you exercise. But in the longer term, regular physical activity, like our person who shared with us in the chat box is doing, helps prevent type 2 diabetes, which is what we're talking about today, but also helps reduce your risk of depression, your risk of dementia like Alzheimer's disease, your risk of many cancers, including breast cancer, colon cancer, lung and stomach cancer. It helps improve your bone strength and helps improve your balance and coordination. So I'm always surprised by all the things that physical activity can help improve. And I think sometimes we think about, we say, oh, I want to lose some weight, so I'm trying to exercise. Well, physical activity has benefits in and of itself. So we want to think about, even if you're not focused on losing weight, there are so many reasons why all of us should try to incorporate physical activity into our life and our day. Although today's conversation is specifically about type 2 diabetes. So if we want to try to include physical activity into our day, it's helpful to know what's recommended. So the current recommendations are that people optimally should have at least 150 minutes of moderate physical activity each week, or 75 minutes of vigorous physical activity per week. So that may sound like a lot of confusion for you. You might be thinking, what does that actually mean? I have no idea. Maybe you've never heard these recommendations. Well, what we want to mention is you can do two types of physical activity, one that's moderate or one that's vigorous. So let me talk first about moderate activity. So if I'm just walking down the street, taking a leisurely stroll, walking very slowly, that might be light activity. That's not the type of activity we're talking about that we want to be doing for our health. We want to walk as much as we can, but specifically today when I talk about moderate physical activity, it would be when you're walking briskly down the street. And the recommendations would like us to all be doing about 150 minutes a week. And one example of that is that, let's say Monday, Tuesday, Wednesday, Thursday, Friday of each week. So 5 days a week, you walk 30 minutes briskly each one of those days. So 30 minutes of brisk walking 5 days each week means you're already meeting the moderate physical activity recommendations. And so how do you know if you're walking down the street whether you're doing light or moderate activity? So one way to be able to tell is if you're walking with a friend or a family member, you should be able to talk to them in full sentences without having to stop because you can't breathe appropriately. But you shouldn't be able to sing them a song. So if you're singing the alphabet song or singing another song to the person right next to you, that means you're not quite doing moderate physical activity. You might want to walk a little bit more briskly. So brisk walking is an example of moderate activity. On the screen here, you can also see some other examples, might be some dancing or doing some housework, or carrying some heavy, loads, or doing some gardening or swimming or water aerobics, even hiking. But the way you can tell if it's moderate is if you can talk but not sing to your partner. So the recommendations say they want us all to be doing 150 minutes per week, which would be like saying 30 minutes of brisk walking. That is moderate physical activity. I also said before that you could be doing moderate activity or vigorous activity. So for vigorous activity, they want us to do less. It would be 75 minutes, which one example would be if you're jogging down the street or running down the street for exercise, it would be 15 minutes, 5 days a week. So Monday, Tuesday, Wednesday, Thursday, Friday, you jog for 15 minutes each day. And if you do that, you're already meeting the recommendations. And I said before that if you were doing moderate physical activity, so you were doing brisk walking, you should be able to talk but not sing. Whereas if you're doing vigorous activity, think about when you're running down the street, you shouldn't be able to talk to somebody in full sentences. You might be saying, hey, Johnny, I need to go to the restaurant, to pick up my food, and you have to stop and pause because you can't, you're trying to breathe, your heart is beating faster, you're breathing a little bit more quickly. That tells you that you're doing vigorous physical activity. So if you are doing vigorous physical activity, you can tell because you're having some difficulty talking to your partner without pausing. And jogging is one example. Fast cycling is another example. When you're walking down, climbing up the hills of Cyprus or in the Trolos mountain, that's a good example. If you're swimming fast, or people who do competitive sports, or if you're carrying very heavy loads for quite a bit of time, that would be vigorous physical activity. So to summarize, they ask us to move towards at least 150 minutes of moderate physical activity each week, or 75 minutes of vigorous activity each week. But that may sound like a lot to you. If you, for example, you are not doing any physical activity, you may say, oh my gosh, they're recommending that I do 150 minutes where I barely do 1 minute of brisk walking per week. So these recommendations are what they want us to move towards in the longer term as our goal. For today, for next week, every little bit of movement helps. So if you are doing zero exercise, starting by doing 5 minutes of walking on Tuesday and Thursday of next week during your lunch break is a great place to start. So every little bit of physical activity helps. So don't be intimidated by the numbers. For those of you like the person that shared in the chat box, they're already doing quite a bit of physical activity. Know that the recommendations are to do at least 150 minutes of moderate activity. So it doesn't mean that once you reach 150 minutes, you need to stop. Actually, the recommendations say 150 to 300 minutes. So for those of you that are here that are already doing a lot of physical activity, know that the recommendation is at least. But for many of us who are not very physically active, know that every little bit helps. Starting with 1 minute, 2 minutes, 5 minutes, or 10 minutes twice a week is a great place to start. And then what you do is every week you sort of reassess where you are and see when you can start going up, so that over the next 6, 12 months, 18 months, you move towards that target or goal. So we've been talking about exercise. Our person who graciously shared in the chat box may also be doing some resistance or strength training. And that's because we want to recognize that physical activity includes purposeful exercise, strength training or resistance training, which would be like lifting weights or doing resistance bands, as an example, carrying heavy bags, carrying the supermarket, or working in a place that has you lift boxes, or doing yoga or things that can build your strength. It's also important to think about your flexibility and your balance, particularly for those that may be listening who are older. For older adults, we want to help prevent falls. And in order to do that, one thing that you want to work on is your balance. So the recommendations say work on activities that help your balance twice a week, and dancing can help that, for example. Or there's an exercise that's called Tai Chi can help that as well. And then building strength training 2 days a week. But you see the last one listed here asks all of us to reduce our inactivity. So while I'm talking to you right now, I'm sitting in a chair, I'm not moving, I'm being inactive. Perhaps some of us have spent the last 8 hours sitting in a chair, working on our computer. How much of that time did you get up and move? Many of us are having many hours of inactivity in our life. So when we think about physical activity, it's not how much we move only that we have to think about, but how much we don't move. So for those of us that sit in a chair, work on a computer, remember you also can think about, are there ways for you to reduce how inactive you are? Because that's important when we talk about our personal well-being and health. So I just put some tips here of ways that people handle reducing their inactivity. Like some people use their phones and put a reminder to get up every hour. So when your phone beeps, you just stand up and stretch, or you stretch in your chair. Or some people, if you're on a phone call for work, or otherwise walk, down the hallways or around your desk while you're on the phone, or walk on every coffee break. Take the stairs when you can. Walk up and down the escalators instead of, when you go to the Mall of Cyprus or the Mall of Nicosia, and you walk up the escalators. Don't just let them carry you, for example. Or if you're watching television or something online that has commercials, every time you see a commercial, you can take an activity break. So let's all remember that physical activity is important, but trying to think about how inactive we are and what things we can do to decrease our inactivity is also important. So if anybody's willing to share, that's in the audience here, are there any thoughts on aspects of physical activity that you are thinking about trying? Or are there things, when you're trying to think about incorporating physical activity in your life, what do you think is going to help you be able to do it? And please feel free to write in the chat box as you like, or if you feel like you want to unmute yourself, you can let us know. while I'm waiting to see if anybody's willing to share, I'll say that sometimes people tell us, for example, I have family members, who say, I think I'm not sure that I can go exercise by myself, but if one of my other family members goes with me, that makes it easier. So I have a family member who started exercising because they're going together with somebody else, and that makes it feel easier for them to exercise, to have a partner to be able to go. Um, and so there may be people in the room that are starting to think about how to start being physically active, maybe next week. Later in this session, we're going to be talking a little bit about how do you choose a goal and make it the type of goal that's easier for you to accomplish. And so I see that some people have been starting to share in the chat box, and somebody says that they make sure they sleep well the night before so that they have enough energy to exercise the next morning. Absolutely. So sleep, as I mentioned before, is very important for our lifestyle. And as somebody graciously pointed out here, sleep can help them feel like they have energy to exercise in the morning. Another person is asking, is it better to exercise in the morning or in the evening, before or after food? So those are good questions. There are parts when it depends on your schedule, what time of day it's better for you to exercise. But for example, one thing you don't want to be doing is vigorous physical activity within the last couple of hours before your bedtime, because that can make it difficult for you to sleep well. So if you plan on doing vigorous physical activity like running or jogging, keep that to at least, let's say, before 3 to 4 hours before your bedtime. Now, if you are thinking of doing something like light yoga, that's okay to do about an hour or so before your bedtime because it can actually help you sleep better. So the timing of exercise depends on what time you choose to do it before your sleep time. And the question is, do you want to exercise before or after food? So there are different thoughts on this. What is somewhat clear is you don't want to have a big heavy meal before you exercise. That makes it more challenging for you to be able to exercise effectively, and puts a lot of pressure on your stomach to try to handle a lot of heavy food and a big volume of food before you exercise. Also remember that it's also about the hydration. So make sure that you drink enough liquids, particularly water, to stay hydrated when you're exercising. So those are, I think, some of the more important points to think about for timing. But the research is still trying to figure out what's the best type of hour of the day to do exercise. At this point, there's nothing wrong with doing it in the morning or afternoon. It's actually what time of day you can fit it into your schedule. Just remember that if you don't want it to alter your sleep, it's better not to do it within a couple of hours before bedtime. So thank you for asking that question. Okay. So we've talked about weight and weight maintenance or weight loss and its importance in helping us prevent type 2 diabetes. We've also talked about physical activity and all the components it includes, which also includes making sure we're not being inactive. And so this is my time to remind you, if you're sitting here watching a screen, you can feel free to stand up and stretch while we continue this presentation. I won't do so that you can still see me, but take advantage and do some movement while we're listening to the rest of this conversation. So the last part that we're going to talk about today is the importance of healthy eating for the prevention of type 2 diabetes. And I can imagine that some of you that are here today are already trying to eat healthy at home. And if so, would anybody be willing to share some ways that you try to eat healthy at home, or what has worked well for you? We give you a moment to share that, because it's always wonderful to hear what's working well for some people like those that are here in our conversation today, because you might get some ideas of something that you might want to try or might work well for you. And while somebody is sharing that information, I'll say that some of the ways I try to do is we go shopping for fruits and vegetables and make sure that we have plenty at home to use for snacks or our meals. We try to prepare them as much as I can on the weekend so that they're ready for me to use during the busy weekdays. And I try to make sure that every meal has fruits and vegetables in it. So somebody in the audience has graciously shared that they've been checking the glycemic index after they were diagnosed with diabetes and checking carbohydrates. So absolutely, if you've been diagnosed with diabetes, thinking about concepts such as carbohydrates and glycemic index is very important. So thank you for sharing that. So I'll keep on watching the chat box, but thank you for those that are sharing. And what I'll say for us here is, I think most of us that are talking in the same room today are in Cyprus. So let's acknowledge the types of foods we have in Cyprus. You know, here are just some pictures from around Cyprus, from my life experiences here in Cyprus, where you may be seeing plates that have, you know, people start with a salad, like a traditional village salad as it's called. And then there may be chicken and some purguri, for example, or at another meal you might, you know, if you're fasting, for example, you might be having some components that include vegetables, like the stuffed vegetables that you see on the picture on the top, perhaps some eggs with zucchini, or some sesame bread, or some tahini sauce, maybe some olives, and maybe for some dessert, you're having some spoon sweets. So Cyprus has a wide variety of foods. The traditional Cyprus diet might have been a little bit different than what we see on the screen here today, because sometimes when you go to restaurants nowadays, they might serve you French fries as opposed to something like a whole grain, like a purguri. So things have shifted, but it's important for us to remember the wealth of foods that Cyprus provides us. And it's amazing that we can, you know, there are so many seasons for fruits and vegetables. You see some pictures from the different seasons here. Right now we're in citrus season, and you can find all these other fruits and vegetables now. So we are really lucky in Cyprus that Cyprus can grow so many different types of fruits and vegetables, and we have access to them. And so what we want to talk about is how we can take advantage of what we have to offer in Cyprus to eat healthily to help us prevent type 2 diabetes. So one thing that's important for us to think of, to understand, are the types of foods that help make it more likely for you to be able to not develop diabetes. So you have less of a risk of diabetes the more you eat foods that are filled with fiber. And that means things like whole grains, legumes, beans, things like louvi or black-eyed peas, whole grain, foods like oats or purguri, for example, fiber-filled foods. There is much research that has shown the importance of eating foods filled with fiber for the prevention of type 2 diabetes. And you have more of a risk of developing type 2 diabetes the more you eat red meat or processed meats, and the more you drink sugar-sweetened beverages, or if you drink a moderate amount of alcohol. So it's just important for us to acknowledge what foods can help prevent diabetes and what foods place us more at risk for diabetes. So the less animal products you eat, the less your risk of diabetes, is what research has shown us here. So the more meat or animal products you eat, the more your risk of diabetes. So the types of diets or eating patterns that have been shown to help prevent diabetes are those that incorporate whole foods and are plant-based. So these type of eating pattern is where you mostly eat a variety of minimally processed fruits, vegetables, whole grains, legumes like beans or lentils, nuts, and seeds. So if you see the plate that is in this image here, and you cut it in half, you see that the half on the left-hand side of your plate is filled with fruits and vegetables. A quarter of your plate is plant proteins like legumes, nuts, for example, and a quarter of your plate is whole grains. So this is what has the most evidence for helping prevent type 2 diabetes, is eating mostly a plant-based diet that comes from whole foods, which are not processed. So let's talk about what that means. So on the left is, you know, a plate that we ordered that in Cyprus that had some meat, some purguri, and some French fries, and that was, you know, a plate for one person. It's quite actually the size of a platter, so portion sizes do matter. If we tried to cut that plate in half, we would see that really there are very minimal fruits and vegetables on that plate. So even if you had eaten a village salad before, a lot of that plate is actually meat or carbohydrates like bulguri and French fries. Whereas if you look on the picture on the right-hand side, you can see that half of that plate is filled with vegetables like that salad and fruit. A quarter is a healthy lean protein like chickpeas or lubi or black-eyed peas. And a quarter is a whole grain. In this case, it happens to be a whole grain pita bread, but it can be any type of whole grain, such as oats for breakfast or bulguri for lunch. It's just you can see the difference on the right-hand side where the bulguri should have been only about a quarter of the plate and not as much as was in that platter, which is much bigger than the plate there. So we want to fill half of our plates with fruits and vegetables, a quarter with healthy plant proteins, and a quarter with whole grains. So it's important to recognize that there are different types of plant-based eating patterns. And in Cyprus, we're in the Mediterranean. So Cyprus had the original Mediterranean diet, which what people ate, the eating pattern was full of fruits, vegetables, legumes, nuts, beans, whole grains and cereals, some fish sometimes, and the healthy fats of olive oil. But the original Mediterranean diet is different than the modern Cyprus diet because it was much lower in meat and dairy foods. So meat and dairy foods were only on special occasions. And so the original Cyprus Mediterranean diet, or the Mediterranean diet from the rest of the region, is a healthy plant-based eating pattern where mostly it comes from plants, and only sometimes do we eat animal products like meats, dairy foods, or fish. There are other plant-based eating patterns. Maybe you've heard of a pescatarian diet, people that eat seafood, but they don't eat red meat, for example, or chicken, or somebody who eats eggs and milk, but no meat or fish or poultry would be this other type of vegetarian, or people who are vegan, who don't eat any animal products at all. All of these are plant-based eating patterns, and it's up to you to choose what is meaningful for you. For many people in Cyprus, that might mean the Mediterranean diet. But think about how this compares to what you're eating now. And are there ways that you can move towards becoming more whole food plant-based? And so when we talk about this topic, lots of time people ask some questions. So I'm going to try to answer those questions here. Well, first question people ask is, does that mean that I need to give up meat and become vegan? Well, not necessarily. As I said, the original Mediterranean diet, people ate meat, just not every day, 5 times a day, right? It was a sometimes food, not an everyday food. It's important to remember that you could choose to go vegan if you want to. That's your personal choice. If you do, it's important to remember that there's some things you're going to want to talk to your healthcare professional about. For example, in the vegan diet, you have to be conscious to make sure that you get enough B12 or a source of vitamin B12. But another point to know is that you could choose to go vegan and still not eat a healthy diet, because a vegan diet might be filled with junk food, because if you go to the supermarkets nowadays, there are lots of vegan junk food products like potato chips, or even French fries can be considered vegan. But also there's some hamburgers, for example, that are vegan, and all of that might be highly processed. So choosing to be vegan or fully plant-based, where you eat no animal products, is a personal decision. If you do make it, talk to your healthcare professional. I do have to acknowledge that moving towards a fully whole food plant-based diet might give you the biggest changes in your health and well-being, in your numbers, but that's not for everybody. And you do have to watch for some things. If you become vegan, as I said, you want to talk to your healthcare professional, because there are some limitations that you have to consider, like the amount of vitamin B12 that you can get in your diet. So I mentioned before that what we want to move towards is eating whole foods, as much unprocessed foods as possible. And so what I'm going to talk about now is what that means. On the left-hand side of this screen here, you can see what's circled in this red box here, that there are unprocessed foods that come directly from plants or animals. So a whole orange is an unprocessed food. A whole apple, a pomegranate, a carrot, an egg, for example, those are unprocessed. But if I take my onions and chop them up and freeze them, that's actually minimally processed because I've done some processing to preserve it. If I salt and dry some nuts, I've minimally processed them. So that is the second category from the left, where you see some nuts, for example, or some foods that are frozen. Nothing has been added to them necessarily. Maybe they've just been dried or frozen, and that's considered a minimally processed food. But now we start moving to processing foods by adding things like salt, sugar, or fats. So if you take a can of beans and you look at the ingredients, they usually have added something like salt. That's considered a processed food. So when you look at the ingredient list and it has 2 to 3 ingredients, maybe salt, maybe sugar, even halloumi, anari, usually salt is added to those. For example, if you make eliesakistes and you add some olive oil to them, or even if you just add some lemon juice and coriander, these are processed foods because we've done something to them to alter them a little bit from how they came to us directly from nature. Now, sometimes we have to do that. You really shouldn't eat an olive straight up by itself without brining it, but it is considered a processed food. The last category on the right-hand side are highly or ultra-processed food. Now, these are the kinds of foods where you look at an ingredient list and it might have 8, 10 ingredients, some of which include artificial colors or flavors like sodas or soft drinks or some types of chips. These involve lots of processing and use multiple ingredients, some of them artificial. So I share all of this with you because when we want to move more towards a whole food, plant-based diet, which we know has benefits for our health to prevent type 2 diabetes, but also other things like heart disease, we want to be eating mostly in the left-hand side of the screen. So unprocessed, minimally processed foods. Sometimes we're going to eat processed foods, but we want to avoid as much as possible being in the right-hand side of the screen where we're eating ultra-processed foods. So let me share what a meal might look like if you try to compare on the left-hand side an ultra-processed meal versus on the right-hand side a minimally processed meal. And so on the left, you can see a Spam sandwich with processed cheese on a white bread, which is also processed, potato chips, also processed, and a diet lemonade. Whereas on the right-hand side, you can see a fresh salad with cucumbers, tomatoes, lettuce, maybe a whole grain of barley with olive oil and garlic, a steamed broccoli, some apple sizes, and beef. So the right-hand side is minimally processed. And notice it still includes meat. They didn't take away meat from this. It's just less processed, closer to nature. These are healthier for us to help us prevent type 2 diabetes, heart disease, and other diseases. So this is an example of what moving towards a less processed diet would look like. And if you're trying to choose foods, it's always better to choose the less processed food. For example, let's say you have a glass of juice versus an orange. It's always better to choose the orange. It has more fiber, it takes longer for your body to process it. It fills you more. It impacts your blood sugar level less. Same thing for those sodas and beverages. It's always better to choose water, for example. Or if you have a snack, better than choosing that package of potato chips would be something like a fruit or some unsalted nuts, for example. So whole foods are always going to be better for you than processed foods and can help you prevent type 2 diabetes. Another question that people ask, they say, hey, I thought I was supposed to avoid all carbohydrates for diabetes. Well, like one of our participants shared, you have to be conscious of the carbohydrates you're eating. But our participant also shared about the glycemic index, which we're not going to talk about today. But what we are going to say is it is better to avoid processed carbohydrates, things like sugar and white flours. So if you're eating a chocolate cake that's full of sugar, that will be absorbed very quickly by your stomach compared to something that's unprocessed, and your blood glucose level will go up quickly. But unprocessed carbohydrates in whole foods are better than processed carbohydrates for you because they're higher in fiber, they take longer to digest, and your blood glucose level goes up less. So it's important to remember that you can eat unprocessed carbohydrates, which would be the whole grains like oats and quinoa and all the whole foods that are minimally processed. Another question that people ask, hey, I thought I was supposed to avoid fruit because some people recognize that fruit has natural sugars. Well, not if you actually focus on eating a mostly varied whole food plant-based diet. So if you're eating a variety of whole grains, legumes, fruits, vegetables, nuts, all the things we've been talking about, you don't actually need to avoid fruit. In fact, there are three very large studies that have shown that eating more whole fruits like blueberries, grapes, and apples actually show the people who ate more of those had a lower risk of diabetes. But those who drink more fruit juice had a higher risk of diabetes. So if you're going to eat fruits, eat it as it came from nature, full of fiber like this orange that I'm holding up here. Okay, and last two things I'm going to mention here are it's also important to recognize that with the prevention of diabetes and also for people who have diabetes, we also want to be aware of fat and salt. With fat, that's because having diabetes and high cholesterol makes you at even higher risk of heart disease and stroke. So we want to focus on lean proteins like beans and fish and chicken, and those things that have good fats like avocados and nuts, but we want to avoid red meat as much as possible. So remember that when you're choosing your proteins and your fats, choose those that are lean proteins and good and healthy fats. Same thing for salt, as I said, having diabetes with high blood pressure makes you at higher risk for heart disease and stroke. So you want to choose foods that are lower in salt. Like on the right-hand side, you want to choose beans, for example, that came in a package and you cooked yourselves in a pressure cooker, as opposed to a canned bean that is full of salt. As much as that's possible for you, it's better to choose it that way. So if it's possible, avoid packaged or processed foods, cook at home, and use less or no salt. You can flavor things with herbs and spices instead. But the most important part about the healthy diet is it's not about starting a diet itself. It's about changing the way you're eating to move it even more towards a whole food, plant-based eating pattern and something that you can continue in the long term. So you have to decide for yourself what are the types of foods you're like, what are the types of things you want to continue eating, and how can you modify how you're eating today to move it more towards a whole food, plant-based eating pattern. But the most important part is nourishing yourself. So the foods that are going to help you nourish your body are going to be those that are that are whole foods and having a mostly plant-based diet. So eat more pulses and legumes, more fruits and vegetables, choose whole grains, but try to stay away as much as feasible from processed foods and try to eat less of those fatty foods, sugary foods, and things that have salt. So if anybody would like to share before we move on to the last section of today, you can go ahead and do that. Are any thoughts on how you might eat healthier, more unprocessed foods or things that might help? And while you're thinking about that, I'll see if anybody wants to add anything to the chat box. I'll just start saying, we've talked about weight, physical activity, and healthy eating. And you may be thinking, those are a lot of options. How do I choose where to start? So let's talk about that while we see if anybody wants to share. So you can also share in the chat box while we start our conversation. Perhaps you've set a goal, maybe with the new year, you set for yourself a goal that's related to well-being. Think about what has gone well for you with that goal And what were some challenges you encountered? Perhaps, let's say last year at New Year's, you said, I wanted to exercise 3 days a week. Did that happen for you? What are some obstacles you encountered? What things made it easier for you to do so? Those are the things that are going to be important for us to understand and think about when we set goals. And so somebody has graciously shared that the things that they do is they look up on the internet healthy foods and they find some they like, and find recipes that they can recreate. For example, that's a great example, is you look up foods and find something that looks appealing to you and see if you can recreate it. Somebody has asked a question about intermittent fasting also in the chat box, but I'm going to save that one till the end. So I want to talk first about, thank you for those of you who are using the chat box. So you may have said this new year, I want to exercise more, I want to eat less junk food, I want to drink less soft drinks. Well, those are goals, but it can be helpful and make it more easy for you to reach your goal if you set something that's called a SMART goal. So a SMART goal is an acronym. SMART stands for specific, measurable, achievable, realistic, and time-based. So you don't have to memorize that right now. This presentation is being saved. What's important about the way you phrase your goal is you want to put as many details in there that make it very concrete, very specific about what exactly you're going to do. So what kind of exercise are you going to be doing? How many days a week? How many minutes? What day are you going to start? Do you have the capacity to do it? Like, do you actually have a gym membership, or have, a time to do a walking break during your work? Is it something realistic? Like, if you were to tell me I exercise 0 minutes a day and I want to start exercising 45 minutes every day for the next 7 days, I might say that's a little bit too much. You want it to be realistic. And how often are you going to do it, and for how long? So it's helpful if you set, let's say, a 7-day goal. So a 1-week goal is something that can help you start making some behavior changes, because what you do is you create a goal, set it for 1 week, and then at the end of that week, you see what happened. What obstacles did you encounter? And try to think about how you're going to alter your goal to help you move through those obstacles. And then next week, you've changed your goal just a little bit and you try again. And you keep on moving forward like a rolling train that moves forward each time, adjusting the goal and continuing to alter it so that it's working for you towards the goal you want to achieve. So let's give you an example of a SMART goal. It would be starting on Monday. I'm going to carry with me 2 fruit or vegetable snacks each workday for the next 1 week. And that's because it says when you're going to start, you're going to do it for a week, you're going to take 2 snacks that are fruits and vegetables, and you're going to do it each workday, so Monday through Friday. That's a very clear goal. It tells you exactly what you're going to do next week. And it's clearer and easier for you to accomplish than that other goal where you might have said, I will eat healthier snacks. So try to set SMART goals for yourself. And as we're wrapping up this conversation, start thinking about, is there a SMART goal that you might want to try, let's say, in the next week or so? Because what you want to do is create a SMART goal. Let's say I want to walk starting next week for the next 1 week on Tuesdays and Thursdays for 10 minutes during my lunch break with my colleague at work. And that's your SMART goal for the next week. Try it out, see what happens, see what obstacles you encountered, and then modify your goal to help you reach it. And then keep going. Keep on moving forward every week, adjusting it until you keep on moving in the direction in which you like. You can use a sheet of paper like the one that I have here to track what's happening, write down what obstacles you encountered, and some solutions. The goal is progress, not perfection, because every little step in the right direction is going to move you forward like that train that's moving in the right direction. So progress, not perfection, because you can take charge of your lifestyle to help prevent type 2 diabetes. Here's a summary of what we talked about today that you can do that could help. You could choose to work towards reaching and maintaining a healthy weight. You could choose to move more. You could choose to strive towards a mostly whole food, plant-based diet, but starting with small steps. So start with setting just one goal, not 5 different goals, but it's easier if you just set, let's say, 1 or 2 goals, and then you create a SMART goal that has detail that tells you exactly what you're doing in the next week. Then you see what happened at the end of the week, follow up, and you continue to adjust your goal to help it move you forward. And your healthcare professionals can help you with setting your SMART goals and helping you to continue to move forward. So if you are patients of the Unique Medical Center, please do reach out to your doctors there or to the dietitian. If you are a general community member, talk to your doctors or dietitians if you have them, to make sure that they can help you with your plan to help you prevent type 2 diabetes. Because we're now in 2023, we have so many new opportunities for wellness with each new day that we have. What is something that you think you can do or will do? I am in a moment here going to put this link in the chat box at the end, because if you are able to give us some anonymous feedback about today's session, I would welcome it.